because I believe that all individuals should have the right to have health care that is accessible, that is steeped in respect and dignity for all. I believe that it should be not a privilege, as it often is in our country, but it really should be a right.
Our children are our future, and to have rich future and those futures that children can thrive in and be their best, we must intervene and we must create an environment that yields success.
I can't imagine not choosing to care. I've been with the Children's Health Fund since 1990, and the Children's Health Fund has really given me a way to fight for health equity for children in this country. And that's what we should all be believing in. Children are our future.
I live in a state with a history of inequities, and this has given me an opportunity to address some of those inequities.
Children's Health Fund is a really good idea and has been for decades. The need has only grown, the expertise has only grown, and I choose to support the people who are doing really important work for really important people.
Well, I've been choosing to care since the organization was first talked about in 1986, so it's something that I'm obviously very attached to. Karen and I were involved from the beginning with Paul, and it's done a tremendous amount of good. There's so much more to be done, and I care about the unfinished work that lays before the Children's Health Fund. And I really thought at this point in my life and career that we would have solved a lot of these problems which are still lingering and hurting the futures of American children, and we just need to get on with it. But that's why I care.
It's the right thing to do, and someday we'll all leave this place and we can leave it better than we found it, and it's the right thing to do.
I hope for a future where every child in America has health care and is able to succeed and thrive in life. And the children are our future, so I think we all need to care.
Children are our future. We need to invest in children, and Children's Health Fund can help provide care that they need, as well as shine a light on the value of investing in children, not only for their care, but for their community and for our country.
I choose to care because it is such a wonderful thing to do. It just feels like the right thing to do, and we should all choose to care.
All children deserve access to health care and to education, basic services, whether it's learning or food, extra resources, and without us there to advocate and be there for them, they won't receive those services.
I fundamentally believe that all children, without exception, deserve access to health care, period. I also choose to care because children are innocent and they rely on the adults in their life, whether we're part of their family, or part of their community, or part of their society, to stand up for them and to ensure that they have what they need to be healthy.
If you don't care, then there's a lot of young people out there that are not going to get the services that they need. So I want to be the one in the number that says I did something to be able to meet the needs of those young people that are lining up at those buses for those services.
The children that we're looking after and the children that we're providing services for don't have a lot of support. They come from families that have been displaced, from families that perhaps don't have the means, understanding, education, or even language to be able to advocate for them. So I choose to care so that I can advocate and that we can advocate for their well-being.
I want to make a difference in children's lives. Kids are our future, and I can't think of a better way to invest in the future of not only kids, but for our communities as well.
I think we can make a difference in the lives of young people throughout this country, and that's what CHF and our mobile units do.
I have two wonderful, amazing, beautiful daughters, and I want every kid in America to have the opportunities that they do.
There's so many incredible kids in this world and in my community, and I choose to care because I want to see the best brought out in them. I want to see them be able to live their best and brightest lives and to be able to experience the joy of childhood and of their world.
Children depend on us to advocate for them. And it's important that we as adults are advocating for the health of all children in this country. That's why I choose to care.